Our next honoree needs no introduction to all of you. Dr Meeker, the CEO of Sanofi Genzyme, came to the pharma industry after a 20-year career in medicine. He joined Genzyme as medical director on its cystic fibrosis gene therapy program in 1994, having previously served as director of the Pulmonary Critical Care Fellowship at the Cleveland Clinic. He was chief operating officer of Genzyme when it was acquired by Sanofi in 2011 and was appointed as CEO later that year. He has pushed for transformative and life-saving rare disease therapies throughout his career at Sanofi Genzyme. He has been a champion for rare diseases, most recently having joined MassBio at the State House on February 28th to honor Rare Disease Day. Sanofi Genzyme organized multiple events to recognize that day, including a run or walk from State House stairs to Genzyme Center in Cambridge, where I had the privilege of joining David, a patient, and a representative from the NIH Undiagnosed Disease Network to address the crowd and raise awareness about rare disease research. Today, ladies and gentlemen, we are honoring him for the sum of that commitment, the significant investment that he has made, both personally and professionally, to our Massachusetts supercluster. As the recipient of this year's Henri A Termeer Innovative Leadership Award, David, you will receive a $1,000 gift certificate from Art in Giving, an organization that combines philanthropy with the arts and whose mission is to raise funds for pediatric cancer research and other health-related initiatives that help families cope with childhood cancer. The certificate enables you to select a piece of fine art from any one of the participating Art in Giving artists. I know that you are familiar with Art in Giving, as Sanofi Genzyme purchased 40 of their paintings in 2014 for your facility at 640 Memorial Drive. I am so honored to introduce this year's Henri Termeer Innovative Leadership Award winner, a true hero and a wonderful, wonderful human being, to our Massachusetts Biotech Cluster, Dr. Dr Meeker. Please join me. Elaine, could you join us for a picture? Congratulations. Here's your thing. We're going to do a picture. Where is Elian, come on up for a quick picture before you. For those of you who don't know Elian Markov, who founded Art in Giving, she's a truly amazing person. So make sure you take a peek at the wonderful work that she's doing for pediatric.
Thank you, Bob, so much.
You get in the middle.
Yeah.
You get in the middle. So you can
Thank you for doing this.
Thank you. Thanks, David. You're up.
So Bob had promised me 15 minutes, and I thought the way we were rushing through that I just lost my 15 minutes. But, one other thing, if you have to be introduced anywhere, get Bob to do it. He makes everybody look good. So I do have 15 minutes. I just want to start by recognizing two people who have inspired me. One is Bob Coughlin, and one is Henri Termeer. And Bob, as you know, is a tireless advocate for this industry. This meeting certainly speaks to that. And at one level, you can say, well, that's his job, and so no big deal. But when I see Bob, I see a father. And he's the father of a son with cystic fibrosis. And every time I hear him advocating for this industry, I know he's out fighting for his son, as any parent would do. And he reminds me all the time that we work in an industry where it's personal. And it matters. And so I thank Bob for that. Second person is Henri Termeer, who this award is named after. And I have to say it's an incredible honor, one to be recognized in the biopharmaceutical capital of the world. I think we can claim that without too much competition. And so, but to be honored with an award in his name has special significance. Henri was an entrepreneur, a visionary, a risk taker. I think he would describe it as calculated risks. But he built a great company, Genzyme, on the simple premise that just you do what's right for the patient. And if you get that part right, the business will take care of itself and your company will do fine. You know, there's been different pictorials of sort of the Genzyme diaspora, and I think about all the people who've gone on to either found companies or be part of other companies and make significant contributions. And we learned a tremendous amount from Henri, and I think of him often as sort of the dean of Genzyme University, and that school is still in session, and I am still enrolled. So in the balance of the time, maybe I thought I'd just make a few comments about the world that we live in. It's dynamic, it's changing. Washington, of course, is a tough place to follow these days. But what's happening is of incredible importance to this industry. And to give you a little context, I'll give you 3 numbers. So I've been at Genzyme for 23 years. Actually, the math doesn't quite work with Bob's introduction, but I've been a physician for 35 years, and you never stop, even if you stop practicing. That part of yourself doesn't go away. But probably equally importantly, I've been a consumer of healthcare for 62 years, if you count the day I was born. And so, you know, with that perspective, this healthcare system matters. It matters to me individually. It, of course, matters to me professionally. And so getting it right and making it work is just one of the most critical things. And so what does that mean? Well, we wouldn't need a healthcare system if there wasn't a patient that needed care. And just so that patient doesn't move too far away from us, and we heard a wonderful story today, you know, you don't have to go very far. You can look in the mirror in most cases, or you know, look across the dinner table, and you know, we all know what it means to be a patient. And patients don't need a lot from the system. They need access, and they need to be able to trust. Unlike most transactions that we have, when we get sick, we're vulnerable. That's not the case when I go to the grocery store, but that is the case when I see my physician. And even though I'm inside the system and I'm a physician myself, I'm still vulnerable in that chair. And I just want to trust that the system is making decisions in my best interest, and that there's not some part of it has its own self-interest, which is distorting the care that I might get. So pretty simple, but not always so easy to achieve. Second part is we have many stakeholders. We're all stakeholders, whether we're healthcare providers or payers or you know, working in the hospital, academics, and certainly the industry. And what do we need? We need this system to work, because no one of us professional stakeholders, if you will, can operate independently. If we're not all working together, and if this thing isn't somehow, you know, working together, aligned around the common goal of trying to improve outcomes, we're not going to succeed. And that all sets up an environment where innovation is possible. And I think innovation is probably one of the most overused words. It's lost all of its, much of its meaning, much of its weight, but we just can't lose sight of the importance of innovation. And I think it's not so hard to understand why, and you all have your favorite examples, and there's a room full of innovation here, I suspect. But I think about this, and I, you know, some of my favorite examples, not in a good way. The probability that I'm going to die of a bacterial pneumonia, or somebody in this room is going to die of bacterial pneumonia in 2020 is, it's not 0, right? And penicillin was invented decades ago, and you know, the idea that, you know, we couldn't address a bacterial infection, you know, today is just incredible. But that's a reality, right? You know, you don't want to go in the hospital for a simple procedure and end up with a life-threatening infection that can't be treated. That needs a new solution, and that is not going to come from any other place than the innovative part of this healthcare ecosystem. We'll talk in a minute about how that works. Alzheimer's, Bob appreciates this example. It's not going to be cured by building more hospital beds. That's not the solution to Alzheimer's, which will, of course, potentially devastate you know, our economy globally, of course. It's not country-specific. So these are problems that need innovative approaches, and that innovative ecosystem, what drives that innovation it's a complex system, and the way I think about it is, the old model which said, if you give a bunch of smart people $5 billion and you put them in a building in the middle of a field and tell them to develop a drug, they might develop a drug, but the probability is extremely low. And it's just the law of averages, right? That's not how it works. And the next great idea, the next great discovery is going to come somewhere. It's going to come. But it's going to come from that vast network of academic labs and biotechnology companies and the like, where people are working and serendipity can take its place, and there's a chance for something to pop. And then the challenge of the other parts of the system is to recognize that good idea and then bring it in and add value. And that critical next step in that whole process, when the idea is there, but the distance from there to potentially a therapy or something that could yield a return is just too great. So it requires financial support. And that's where the venture capital world becomes absolutely critical. Somebody's got to step in there and put high-risk dollars to work. And they are extremely high-risk dollars, as we know, and we know the numbers and the averages and the probability of success. So that has to happen. And then, of course, somebody's got to take it and do the heavy lifting to get it over the finish line. And so, the rest of the biopharmaceutical industry steps in and has to carry that over. Now, that whole system works, but it depends on one very simple premise, which is, at the end of the day, there's a return, which means we have to get a return on that investment. Now, it's not by accident that drugs are developed, the majority of drugs are developed in the United States. And I will argue, I think maybe many people would agree, that's for one major, it's not because we're smarter. Most of you have traveled, I travel around, I'm impressed by the intelligence elsewhere. It's because the incentives are here. And when you remove the incentives, this will slow or it will stop. Now, what does incentive mean? So that gets us to pricing, and I understand there's a bill that's just being introduced now that's going to go at the heart of pricing. And this is, industry says it's a threat, and it is a threat. Now, our position, our obligation as an industry is to be responsible partners, responsible members, stakeholders in this healthcare ecosystem, which means we do not have a blank check to price our products. That said, we need a return. Now, that return, we have a contract with society which basically says that when we get that innovation, there will be a period of time during which we will have protected ability to sell our drugs and to get a return, and then at some point that will come to an end. And when it comes to an end, then generics and increasingly biosimilars will step in and the price will drop. And that's the way it should work. And with the new Scott Gottlieb now in the FDA, and that's certainly one of his, and I think as an industry we're going to support that, which says that part of the system has to work because that's a societal contract. And then we have to think about pricing our drugs responsibly, which means recognizing the value, but it also means that you don't get to endlessly take price increases year on year just because you can. And I think as an industry, we need to increasingly self-regulate. And there's more discussion about this, and I know inside our company, we're having very different conversations than we used to have about this, but this is an absolutely critical component. If we get regulated, and if somebody steps in, i.e. the government, and begins to regulate this, the probability of innovative solutions for some of the most devastating problems we confront will slow or stop. It just can't work without the incentives. So our challenge as an industry is A, to self-regulate, B, to be advocates for a responsible solution, which means yes, at some point the protected period ends, and yes, at some point society gets an incredible return, which is that expensive drug is now available for pennies a day. That's how it works, and if it does, the ability of this industry is unlimited, and I could not be more of an advocate and more positive about the future of this industry. And so I'll close just to highlight a couple things, 2 examples. 1991, Genzyme, the first therapy for Gaucher disease, Ceridase, an enzyme replacement therapy for a rare genetic disease, was approved. A starving small biotechnology company, thinking there was a few hundred patients out there and just desperately just trying to get a drug approved to survive. That drug, turns out there were many more than a few hundred patients. There's now 8,000 plus patients around the globe who are receiving enzyme replacement therapy or treatment for Gaucher of some form. And if you're a child with Gaucher disease and you're born and you have the good fortune to be diagnosed before irreparable damage, you can live a normal life. and that was a potentially life-threatening disease, and certainly a disease with severe morbidity if it goes untreated. And that's the power of this industry. 2 days ago, we had a drug, Sanofi Genzyme and Regeneron, a drug approved for the treatment of atopic dermatitis. Atopic dermatitis is a disease that comes under the classification of eczema, and it highlights perfectly some of the great challenges of the healthcare system and us as an industry, and most specifically the patients who suffer from these things. Eczema, everybody can go say, I had eczema once. It was no big deal. And the reality is, yes, there's different forms of eczema. And the eczema we're talking about, atopic dermatitis, moderate to severe atopic dermatitis, is a devastating disease where your skin inflames and the itch associated with that inflammation is so severe that you're constantly itching. You're up 5 to 7 nights a week with your itching. When you travel, one of the stories was that they traveled with this individual traveled with their own sheets because they were too embarrassed to wake up in the morning with blood all over the hotel sheets. There's a face to these diseases that goes unrecognized and can't be captured in a bar graph. And part of our challenge, whether it's with the patient with Gaucher disease or the patient with atopic dermatitis or whatever, is to give it a face, to give it a voice that helps people understand that this is the problem that is affecting that individual, and it is personal. So we are incredibly fortunate, I'm incredibly fortunate to work in an industry that can make the kind of difference, but we have to take care of it, we have to nurture it, and it's going to be some heavy lifting and some work to do, I think, over the next few years. So once again, Bob and the directors from MassBio, thank you very much for this award. It's truly an honor, and thank you all for coming.
Thank you so much, David, and thank you for your leadership. I mean, we are so fortunate to have so many amazing leaders here in Massachusetts for this industry, and today is your day. That is a wonderful award. Some of the folks who have received that award prior, it's truly the list of what we like to say, the real biotech rock stars. So today you can go home and tell your family that you've achieved rock star status. Oh, they'll believe it.